Hey guys, welcome back. Episode 23. Last week we talked about a distinction. Are you active or are you passive when it comes to controlling your lumbar spine and pelvic position? This is crucial for anybody wanting to be a land athlete or moving around on their feet regularly, that they have the ability to control their midsection. Now, being active or passive is a very clear distinction. The last video helped to clarify that in a very simple way. What we're going to do now is we're going to talk about some very early level correction exercises that you can start to do on yourself to train the right muscles to work in coordination. One of the biggest problems we see with people who fail core stability programs, if you like, is that they are often given exercises well beyond their capacity. And most of the problems occur because they've never been taught how to coordinate the right regions together and add load on progressively. They've been given an exercise which has too many variables and requires too much control. So what we're going to go through is a very simple exercise, but I use it a lot with my athletes of all levels, from elite to recreational, and the gains are massive, okay? And once you start layering on difficulty, it relates to functional transfer and functional movements enormously. So for this, you're going to need a floor space. I'll use the bed so that you can get a better perspective. And all you're going to do is you're going to get yourself set up onto the bed with your knees, with your heels tucked up towards your bottom. Now, for the purposes of this demonstration, I'm going to take my arm out of the shot and put it above my head. But for the purposes of what you're doing, you'll keep your arms by your side the whole time. Now, what we see a lot from last week is we have people who adopt a position which we consider to be very passive, which is this big extended position, rib cage up. And if I pop my hand underneath, you can see my fingers now because the gap under my back is so pronounced. This drill is about eliminating that lumbar curve and gap completely. In order to do this, we have to coordinate three areas at the same time. First one is we're going to have to get this rib cage coming down into a forward position over the stomach. The second one is we're going to have to draw the lower abdominals in towards the bed, almost as though you're trying to get into a pair of trousers which are a size too small, and you suck your belly button in towards the back. That's two components. The third is we have to actively try and recruit our glutes at the same time. Now, for many of you, this kind of three-part coordination thing is going to feel very clumsy and very difficult, but the more you practice this, the easier it is to recruit this on. So it looks something like this. Very simple. All we're going to do is set up on the bed. We are literally going to have the patient place something under the small of their back. It could be a hand, it could be a small pair of socks. It can even be an elasticated band which will retract if you extend. All of these are absolutely fine tools and good feedback strategies. In this position, what we do is we first encourage our patients to be able to switch on different bits. So we get them to understand how to bring the rib cage forward into a forward position. We teach them how to be able to brace the lower abdominal region. And then we also teach them how to squeeze the glutes at the same time. Now, being able to do all these three as I am now, whilst continuing to communicate, is the level that we would expect our athletes to get to. At first, they're going to hold their breath, going to brace, and it's going to feel like a maximal effort required to keep this lumbar spine eliminated. Of course, the outcome of this is we should be able to keep positional control whilst moving a segment through as much range of movement as we choose necessary without there being any structural change in the spinal position. It should remain the same. What we see, of course, is whenever a limb is moved away from the midsection, the people go back into this horrible extended position so they can create artificial stability. We're after active stability, so recruiting the right stuff to keep you where you should be. We teach our patients to do this drill and to hold the contraction for up to 15-20 seconds and relax off. And once they've done a series of these, we get them to take the feet away from the bottom further away. And then we repeat the process, organizing with those same three regions working together, get used to controlling those areas, relax off, we take the feet further away, and we brace again, and relax off, and so forth. What we find is that our guys have difficulty, first of all, coordinating those three areas at the same time. They complain that when their rib cage comes forward, their bums go to sleep or their tummy starts to poke out, and they find it very difficult to have all three regions working simultaneously. It is tricky to get the glutes firing really hard when you're in that kind of flex position, but it is possible to get some activation there, and we encourage as much as we can get. The biggest thing you'll see is if the hand's underneath the back, it'll feel like they are crushing your fingers when that kind of area is switched on correctly. At first, we train them to hold static contractions, isometric contractions, without any movement, 3 or 4 goes in each position until that becomes very natural for them to switch on. At first, the cost of the position is very high, so people feel like they have to maximally contract to achieve it, and they shut everything else down, airway and splinting with the shoulders, all sorts of mechanisms come in. Of course, to be functional, our patients and our athletes have to be able to switch this stuff on at a very low level whilst allowing normal movement. We're going to talk about the evolution of this drill into a drill which encompasses and incorporates some movement, and then how we transition that to athletes on the feet doing functional movements over the next few episodes. So, as usual guys, please give us any feedback, and your comments are always welcome. Have a go yourself and see how difficult it is.